And we just need to face that and move on. That things are going to change. And I mention that because people talk about it all the time, and I think we should just not make that our main deal, because we're not going to be able to keep what we have. Guess what, guys? Things are going to be different in the future. And so our main focus is on is making sure that what happens in the future is not going to just wipe everybody out and really cause us to ultimately go to a single payer system. And that's what I really want to focus on. Now, what the president is focusing on is some key points that he says that are his sort of lines in the sand. And one of those, and you can see what they are: undocumented immigrants are not going to be covered. These are the hot button controversial items. No public financing of abortion. The like what you have if you can keep it. Again, that's not true. Existing coverage will not change. It will just become better and less expensive. Also not true. The public option will be limited to small employers and uninsured individuals. We will not increase the federal deficit by 1 penny. And the bill will cost $900 billion and be financed mostly through administrative savings and cuts to waste, fraud, and abuse. And the people who pay premiums, of course, will run all the taxes. But and then I would say that they are very involved in congressional negotiations, and I think we just need to be honest that there are going to be some changes, and the president may want to keep all of these things, and he's not going to be able to. We're too large. The changes that they're proposing are too broad scale, and it's not possible to do those things with the type of changes we're talking about. That's impossible. That's not going to happen. So, okay, here we go. Now, the next thing that's very important, and then I'm going to get into the discussion of the issues themselves and where we are with them, is the CBO, the Congressional Budget Office. If there's one government agency that's been really frustrating to the administration, and as well as some of the key committees, it's the Congressional Budget Office. Because there's this little rule in Congress that says, you have to say how legislation is going to be paid for. If it costs federal dollars, you have to find a way to pay for it, right? Well, there is that rule. And the Congressional Budget Office has this little, they're responsible to say how much things cost. Now, one thing that you should understand about the way there's scores, that's what it's called, how much it costs is called putting a score on it. They're limited to looking at it on a 10-year window. They have to just look at just what the facts of the issue are. And they look at federal government costs only. And they in general don't calculate in changes to infrastructure that are required to achieve the cost. So for the most part, and the CBO does a pretty good job, but they're always low. So whatever the score ever is, you can add some on, that it's going to be more than that, because there's certain things that they cannot possibly factor in. I've never seen a score that came out that was too high. Now let's talk about the issues themselves. This issue of the government-run public plan, and I want to make sure that everybody understands what we're talking about here. There are two things that I find people get most confused about. One of them has to do with this idea of creation of exchanges and the government plan, and it is not the same thing. It's two separate things. So the government plan is a program that would be run by the federal government. In some versions of the bill, it could be run by state governments, and it would compete with private plans. And the issue is that it would not be subject to the same rules as the private plans would. So depending on what version of the bill you look at, it may or may not be subject to the same solvency requirements, definitely does not pay state premium taxes, definitely pays providers at Medicare or Medicaid rates as opposed to commercial rates. And if we look at the government plans that we have today, Medicare and Medicaid, who underpay providers, we already know this, the cost shift just from those two programs alone results in an additional $1,800 a year for the average family of four with private coverage. And that does not matter whether they're in an individual plan, a small group plan, a large employer self-funded plan, because this is a matter of the cost shift and what the providers, the doctors and hospitals, charge private pay patients to make up for what they lose from government payers. Now, if we add in another public program that is for pretty much everybody in the country could participate in, that's going to make that cost shift even worse. So the cost for private coverage will go up, and the cost for the public plan artificially low, right? And that's the very biggest problem that we have with this. Then there's this idea that I told you that Kent Conrad had about, well, what if instead of, and everyone understands the cost shift thing, they just don't care. They think, look, their idea is that the insurance companies have been ripping people off for years. They don't understand about, actuarial science about how rates are developed and things like that, because their idea is that that is all not true, and that insurers are raking in giant profits year after year. And those of you that work for insurance companies know that the profit margins, I'm sure you've seen your own reports, are pretty narrow. They're pretty low, particularly as compared to other industries. And that's just factual. That's not bailing out any particular industry. But this idea, the idea that Kent Conrad came up with, was whether or not we could have cooperatives instead. Now, the cooperatives would be not run by government. They would be member-run. Actually, they could look like a nonprofit HMO, but they couldn't be one according to the way the legislation is written. And we have some examples. If any of you are interested in this topic, get with me later. There's a group health cooperative in Seattle. It's really a nonprofit HMO is what it actually is. And brokers sell it like anything else. So it's I guess it's the devil in the details and what the details of the cooperative would look like in the end. Certainly it's preferable to the other style of public plan where the government's running it, but I can't see why we need it. We already have nonprofits all over the place. So that's a possibility that could be in there. And then the other possibility is that, of course, there's a possibility we have no public program in there. And by the White House has said that a public program does not have to be in there for them to sign it, the bill. So there's a good chance that it may not be in the final legislation at all. Or there's a possibility of this trigger that I talked about a few minutes ago, that Olympia Snow has kind of championed this idea. And under that idea, there would be some sort of a testing period to see whether or not, with all of the changes that are included in the bill, whether or not the cost of private coverage comes down by some measurement that they would come up with. And if it doesn't, only then would a public option be triggered. Now, the reason I think it's dangerous is that the same people who would be starting the public option would be the ones figuring out what the trigger is and when it would be triggered. So we're definitely going to be opposing a trigger, although we are also going to be thinking about, if you had one, what it would look like, at the same time, so that it doesn't work. You've got to have some sort of arm's length thing about who decides when the trigger is activated. Of course, we're hoping that doesn't happen at all. But that's the public plan is the most controversial thing in all of this. One of the things that is not on my list here, but that I want to mention because it's gotten so much news in the last couple of weeks, because I want to skip down to the individual mandate. One of the first things that happened is that the insurance companies came out